Lewis and Megan are two 12-year-olds from Derbyshire who are both autistic and have learning difficulties. Today they've come for the first time with their mums and siblings to the Healthy Living Centre in Staveley near Chesterfield to do something that all children love.
Swimming has benefits for all abilities, whether it be someone with or without a disability. I think there are additional benefits for people with disabilities because once you get in the water, you actually remove some of the barriers that actually land transfer or land mobility inhibits them on. Once they get in the water, they become far more independent and free. And we recognise that swimming is probably the ultimate physical activity to do across all the sports. Swimming has such a huge physical benefit in terms of health-related fitness. And fitness is not defined by elitism, fitness is defined by how you individually interpret it. I didn't take up swimming to become a Paralympian, I took up swimming to do swimming, and that happened to lead me to the Paralympics.
Derbyshire County Council is one of 21 Pathfinder councils to be given funding from the government's ambitious Aiming High for Disabled Children programme. It's used a relatively small part of its total £8 million award to widen participation in swimming for disabled children and young people.
We had a number of stakeholder events with parents, and we had a consultation with the children and young people themselves to find out what sort of things they wanted to do. Swimming was something that came out as one of the strongest activities that the children and young people wanted to do. Any child loves getting into the water, and some were finding it very difficult to access swimming sessions within their own community. It was the most popular activity that was highlighted by both families and the children and young people themselves.
The council also wanted to find a way of getting disabled children and young people to use mainstream facilities.
We realised that part of our spend should not necessarily be on specialist services, but we needed to be getting out more into the universal services and spending a good proportion of our money making those services more fit for purpose in terms of children and young people with disabilities. For us, it meant that we could actually reach a whole range of children with disabilities, not just those that met the Aiming High agenda, because by upgrading universal services, that could only have a positive effect on disabled children and adults in general.
To do this, the council brought in a number of partners. Derbyshire Sport was the lead coordinating agency.
It's my job to ensure that other people are inspired to develop more opportunities for disabled people. So I'm passionate myself about disabled people having the opportunity to have choice and opportunities locally to them, that whereby they can take part in walking groups and jogging groups and go to the gym and swimming and make sure that they have a real positive and exciting experience so they continue to participate in sport and physical activity. Aiming High has core funding to enable disabled young people to access opportunities. We saw it as an opportunity to collaborate together to really look at how we could increase the accessibility within the facilities in both physical but also in attitudes and cultural changes. So between myself and Jan Goodwin, who is part of the Aiming High project team at Derbyshire County Council, we worked together to look at how we could best do that.
For children like Lewis and Megan, the opportunities for them to exercise are quite limited because, for example, they're not able to sort of run in the same way that any other child might. So it's one of the few things that they can do that can give them, a good amount of exercise.
For Lewis and Megan, the swimming experience can be greatly enhanced by the use of specialist equipment. Martin Mansell is a Paralympian gold medalist, a Derbyshire resident and a manufacturer of a range of sophisticated buoyancy aids, the New Age flotation system.
Which is basically a range of devices that you can throw into a swimming pool anywhere in any depth of water and basically lie on or use as a support mechanism to create a floating sensation for all abilities. It specifically has assets that lend itself really well to kids with disabilities, particularly those kids with a more severe physical impairment or those that we now know in educational terms more complex needs. To me, it doesn't look like a disability swimming aid. That's the great thing about it. It just looks like some fun piece of equipment that can be totally inclusive.
I think with the flotation devices, it gives them that added support in the water and the security of knowing that they're safe in there, which they quite enjoy.
This product is probably in about 50 to 60% of all special schools. When the kid goes to the school, they can use it. The question is, when they go out of school, they might not go to a leisure centre because they've been used to using this and it's not there in a leisure centre. So the real issue is how we make that transition now from the school use into, for want of better words, the community use, and into a leisure centre and leisure recreational facilities is probably the next step for it to go.
And what Derbyshire did next is what makes this project innovative. Working with Derbyshire Sport, the County Council approached all of its 8 local authorities with a forward-thinking deal. If the local authorities would extend the existing free swim scheme for all children in their leisure centres to also include free swimming for disabled 17 and 18-year-olds, then the County Council would fund the purchase of the flotation equipment and the cost of training staff to use it.
It was a trade-off with a lot of the leisure facilities that if they were to have an individual package of equipment per leisure centre, we would deliver the training across leisure centres. And the reason for that was that we could bring people together from the various different leisure centres in a district or a borough so they could share skills and experiences about where they've perhaps previously worked with disabled people.
For the County Council, it was a big return for a relatively small investment.
The whole cost of the flotation equipment was around £25,000 in terms of our overall budget and in terms of the number of children that are going to be given a short break activity within their own community. That is a small amount of money, really. And the spin-off from that is as well that as they reach adulthood, and some adults are finding that they can also use it. So the pools have found it not only useful to encourage families to come into the pools, but also have been able to put on extra sessions for a variety of children, young people and adults with disabilities to be able to use the equipment as well.
The deal hit several targets. It increases access and usage not only for disabled children and young people, but also siblings and parents who come with them. This transforms a trip to the leisure centre into an everyday family experience.
Before that, we really just used the woggles and the floats, where we'd maybe have to use 2 or 3. We can just put one of the float stations around, one of the bands around them, and off they can go. We can just get them floating a lot easier.
It made access to those facilities for disabled young people free, and it brought together a whole series of agencies in a successful partnership.
This project is a really good example of project working and partnership working across a number of agencies, both statutory and private and public sector. We've engaged Aiming High, Derbyshire Sport and the local authorities, education and the Primary Care Trust, and it's been a long task to try and get this project off the ground, and we've successfully done it.
In terms of the project in general, we are now getting a number of referrals in from families who hadn't had services before, and I think that is quite pleasing for us because we are starting to make a difference. We're also getting a number of individual stories back where children and young people are actually doing activities they never thought they'd be able to do.
There are not many things, again, that Megan can do with her brothers because of the different abilities that they've got. So swimming is, again, something that they can all participate in and have fun with. You know, it's one of the very few activities that give them that opportunity.